Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, my friends, welcome back. You're watching Healthy Living on KUAM. They are the happy face to greet you when you get home from a long day of work, and they crave attention and affection. They fetch, they purr, they never talk back, sometimes, but they may bark back. Our pets are our lovable additions to our families, and there are many good things about having a pet, as research has shown that living with pets can help lower blood pressure and lessen anxiety. They can also boost immunity, but with the good, of course, comes the inevitable bad, like ticks, ringworms, and all of that shedding that we all love so much. Tonight, we have a special treat for viewers because not only do we have our favorite physician, the lovely Dr. Jitka Lom, in studio tonight, but she is joined by her friend, veterinarian Dr. Lisa Silk. We're going to talk about pets and your health. Ladies, thank you so much for coming in and half a day. Dr. Silk, very nice to meet you.
Oh, thank you.
Okay, so I want to touch on something first because Dr. Lom and I have actually talked about doing a segment with a veterinarian for so many years. Of course, when Jitka, you were getting your medical degree, you're studying all aspects of the human system, but Dr. Silk, you have to learn over a course of, I believe, 8 years, you have to learn about all different types of different species.
That's right.
How difficult is that?
Oh, very. Actually, my brother went to medical school at the same time I was in vet school, and every time he would complain, I would say, oh, you're only doing one thing.
Did you take a generic type of, like, say, anatomy or kinesiology and everything and then apply it to different species?
No. When we took anatomy, it was a whole year, and we had to do every different species. The ruminants, the horses, the birds, everything, reptiles, fish. Well, so we would just do one section at a time.
Well, kudos to you for doing that, and certainly we do appreciate the fine work that you do here on Guam because we do love animals here.
Yes.
And as you know, as we hinted to and we alluded to in the intro, we love our animals, and yet they don't mean to, but sometimes they can pass illness or disease onto us, which can often get very very interesting. Can you tell me about zoonoses?
A zoonosis means that it's a disease that an animal and a person share, and it either means that they can both get the same disease or your animal can give it to you.
Mm-hmm. And what are some of the telltale signs about having that, like as far as symptoms or what?
Well, it depends on what you're talking about.
Mm-hmm.
There are some diseases that pets get that we are not the host for, such as internal parasites that we can accidentally get, and those parasites don't really know where to go once they're infected into us because we're not the right species, and then they kind of get lost. In a pet, they would end up going into the intestinal tract, which is normal, but if a human accidentally ingests the eggs, say a roundworm or a hookworm, they get lost and they can end up in our eye or in our brain. It's not very common, but it can happen.
Man, sounds pretty nasty.
Yes.
Yeah. Now, I'd like to discuss with the both of you what are some of the, if you think of it maybe in terms of a Venn diagram or what the crossover is. So Dr. Lom, if someone comes in and says, I'm really not feeling myself lately, I feel kind of weird. And then of course, you go through the typical 20 questions. Do you have a dog, a cat, an alligator, a parakeet, what like? Is there any point when you say, you have to bring in like one of your colleagues from veterinary medicine, or you actually send the person down to the vet and just say, you might want to go check out this person because I think you might have something that she can address better than I?
Well, sometimes people will mention that their pet also has a problem. Like, for example, they might have a skin rash, a ringworm, and they might mention that their pet has, mange. Or, for example, somebody who has parrots might start coughing, and then we might say, okay, is this related to your birds, or sometimes with your cat at home, people might start getting a cough. So there's a bit of a crossover that way. But recently I had a man cough up a worm about this big. So we did send him to infectious disease, but not a veterinarian.
Do you also see like a bit of crossover between some of your patients from the types that you deal with and then their owners, and you have to send them back to Dr. Lom and her colleagues? Or?
Yeah, the most common here in Guam would be scabies and ringworm, which are skin diseases. Scabies is a little mite and here in Guam we have a lot of mites and a lot of external parasites because of our weather. But if an animal is scratching and losing hair, and they'll really be scratching, very, very itchy, and they'll be losing their hair, maybe a secondary skin infection, I always ask them if anybody in the family has a rash. It'll look like little red little pimples in their arms or their abdomen, wherever they've been holding the animal.
Well, that's an interesting word, scratch, because I'm a big rock and roll guy and I grew up playing heavy metal. And we all know Ted Nugent had that great song, Cat Scratch Fever, in the 70s. And we all know the Motor City Madman was talking about something entirely different. But, you know, there is something known as cat scratch disease. So can you illuminate that topic?
Cat scratch fever is actually a bacterial infection. And Dr. Lom can talk about the signs that humans show. Cats are just carriers. It's usually the bacteria underneath their nails. They do dig in their litter boxes and dig in the ground to bury their feces, and they can be carriers of that bacteria. And if they scratch you and your immune system is not what it should be for whatever reason, if you're sick, on chemotherapy, have AIDS, then that bacteria can start to overgrow.
Okay, well, I'll tell you what, Dr. Lom, we're going to get to you in just a moment. We have some Facebook questions, I'm quite sure, coming up, but we will come back right now. We got to take a commercial break, but stay tuned because we will pick up our discussion when Healthy Living returns. Please stay tuned.